Yeah, so I think a few key highlights so far in the last couple of days. One is this very active discussion on the origins of myeloma cells and the fact that increasingly the evidence seems to suggest that there are these pre-plasma cells, B cells, that may be seeding the disease and this kind of population of cells that are currently not targeted by our treatment that may lead to future relapse. So this kind of changes the way we think about how to treat myeloma patients, particularly with all these immunotherapy that are targeted against antigen that are expressed on plasma cells, because then they will miss out this population of cells. So we may need to deploy better technique to understand what these reservoir of precursor cells look like and how we can target them if we are to completely eradicate all the tumor population in the future. And also increasingly obvious is that plasma cells may accumulate mutations, including mutations in important genes over the lifetime of a patient, but they don't always develop into MGUS, and MGUS don't always develop into myeloma. So there must be something else that is going on in the patient. And what is emerging is the importance of the context of the microenvironment, and if the microenvironment also changes as someone aged, because myeloma patients tend to develop in older patients. So I think this whole piece of the microenvironment will be something that is important to study deeply going forward, because in the past decade or two, we have focused almost all our attention on the genetics of the myeloma tumor cells. But what is emerging is that the microenvironment is important, but also looking at other things like protein expression and the immune cell composition is going to be very important for us to really understand myeloma and to tackle this disease at the source or at the core.